Welcome back to the podcast. I wanted to introduce a new friend, Reda Tolba, who is currently going to be in charge of the International Society of Pain and Neuroscience. I met him at Aspen. He's very accomplished. He is currently the head of Cleveland Clinic Pain in Abu Dhabi. And I just wanted to welcome you to the show. Welcome, Reda.
Thank you, David, for having me with you, and I'm very happy to be with you today.
So tell me a little bit about your practice and your background and your training. I mean, I have your CV here. It's very long and impressive. And if you could just, give us a little story about your journey.
Sure. So actually, my background, I'm originally from Egypt. I grew up in Cairo. And, actually went to medical school there. Then after that, I went to the US, started my residency and fellowship at Cleveland Clinic, Ohio, where I really liked the pain management at that time. We had all superstars of the pain management world. And I remember as a medical student, I had a rotation there, and I was really kind of impressed by the Cleveland Clinic and also by the pain management. And we were talking about 2004 here. So pain management was really early, wasn't as accomplished as we have. So I stayed there, then I started my residency, trained in Cleveland Clinic, did my fellowship there in Ohio. Then I moved to New Orleans, Ochsner, practiced there for almost 6 years. And during that time, I actually founded the Pain Fellowship. So I was the first program director there, but I didn't. I actually was recruited to Wake Forest to join the group there in Winston-Salem. Stayed there for about 2 years. And in 2019, I decided to move to the other side of the globe, back to Cleveland Clinic again, but in UAE. And it was so far, it's quite a nice journey.
Was it difficult getting credentialed in the Middle East, or did?
Well, it's a lengthy process, let me tell you.
Sure, imagine.
Not easy at all. So if you think about the getting medical license in the US, well, in the Middle East, it takes quite a long time. So it took me about maybe more than 8 months to get the
Oh, wow.
paperwork done. But eventually it does, because again, UAE, there's all of expats, which is people
Sure.
coming from all kind of the world. So they are familiar with that, with different
Is,
nationalities, different
is it a
religions.
safe, sorry, is it a safe assumption that there's less of an opiate issue there than there is in the United States?
Well, that's kind of the assumption that I had. So the answer is yes or no. So the yes part, yes, because we didn't see that history of opioid epidemic that was created back in the 90s and early 2000s, all the high dosage of opioids. So we didn't have that per se. However, the human nature or human behavior, you will always find substances to kind of, get addicted to or get used to. So when I came, first things was talking about tramadol and Lyrica as the medications of the creation, which we never think about that way on the US.
Right, sure.
And I was intrigued by that. And people, as you know, David, that people get creative sometimes when it comes to, addiction. Having said that, again, we still have the opioid, again, issues, but not at the scale that we have seen in the US. But again, we have young population, and we have, like any country, we have depression, we have chronic pain, we have other psychosocial issues that can affect that. And so it presents really a different challenge. You don't see the opioid dependent on high dosage, but you also see patients who have different types of pain that's hard to treat. Like you see in everywhere, chronic pain syndromes, fibromyalgia, different myofascial pain, all kind of
Sure.
pain that, again, the pain threshold is different. You see other psychosocial issues that can affect the pain. But again, it's a different challenge, but I wouldn't say the epidemic is as bad as the US for sure.
Do you find that you have the same tools at your disposal when it comes to treating pain? I know I went to lecture in Jerusalem and they didn't have, I mean, this was a government hospital, so it wasn't the private sector. But in the government hospital, I start talking neuromodulation, PNS, and they just shake their heads because they didn't have it available.
So actually, I'm very lucky to be in Cleveland Clinic, Abu Dhabi, and here we have a lot of resources. So, I mean, neuromodulation was not as advanced as in the US per se, but we had two companies there. So I was able to do all type of advanced neuromodulation here and some dorsal ganglion stimulation, which wasn't done before in the region. We also have intrathecal drug delivery. So we have the resources, definitely. In terms of technology introduction, the minimally invasive stuff that, we see it a lot in Aspen, like side joint fusion, mild procedure, other type of, minimally invasive things. Sometimes it takes a while for this products to come internationally from the US or from Europe to the Middle East. So that could sometimes represent a challenge to be up to date with certain things in pain management. So it could be 2, 3, 4 years behind. But there's always, eventually we get those technology.
Right.
So I would say we have the resources, but sometimes we try to get everything and be up to date, but sometimes there is a lag until we get the product approved also by the regulatory bodies here as well.
Sure. And our referral patterns, because you're dealing with Cleveland Clinic, is it similar to the States? Usually it's neurosurgeons sending patients, or neurology, or is there some other common route in your practice in terms of getting referrals?
So believe it or not, most of the referrals are word of mouth.
Okay.
Actually, people come
I
in
believe
from
it.
us just Abu
That's how,
Dhabi.
that's how it goes after a while.
So yeah, sometimes you treat a patient and you have a family member, and then they'll get you the sister and the brother and the cousin, and the word of mouth. Then you begin having a good reputation. So you only not just have patients from Abu Dhabi, but you have patients from other Emirates who wants to come and get treated. Of course, we do have internal referrals from primary care, neurosurgery, neurology, general surgery, rheumatology. So we have the internal referral, but actually most of the referrals are word of mouth, self-referral, which can be kind of a very good thing, but also sometimes a double-edged sword, because you can get sometimes patients coming without investigations. You need to do further investigation for them.
Sure.
So again, so different kind of referrals, different patterns of referrals. Sometimes, like we do here, we try to outreach, go to meet physicians outside and try to encourage them to the offer here is different than other places. So I mean, we're thankful. We created a very good reputation in the region.
Sure. Well, I mean, Cleveland Clinic's a big player, so you also have a really nice foundation. Tell me about ISPN. I know there's a conference in Dubai coming up in December, and you're basically in charge of it. So I'd like to hear about the conference and let everybody know.
So I'm very excited about ISPN, and basically the story started about 4 years ago. When I would say Tim, Dira, and Dawood, and the leadership for Aspen. When Aspen started, which was about maybe 5 years ago, and then I was actually leaving at that time to Abu Dhabi, and I talked to Tim Deere, Dr. Tim Deere, and I told him, like, look, why don't we do like an international division of the Aspen, and since Aspen is getting a lot of traction, a lot of popularity, people are going to the conference, there's a record breaking attendance every year, it keeps increasing, and we want to take that momentum and build that culture internationally. There's a lot of hunger in this region to have the society, have the mission of the society internationally. And this is how it started. And then so I was in touch with Tim Deere and Dawood Sayed, Dr. Sayed, and then the Aspen leadership, and we start kind of getting traction. So first we called it IASPN, International Division of Aspen. Then we called it eventually ISPN. We had a couple of webinars 2 years ago, and it was very popular. And we said, let's have a strategy to get started the meeting. And I think we championed it here, and Dubai, it would be a very attractive place for everyone to come. And also there are a lot of hunger from physicians in the Middle East, but also outside in the Far East, Europe, South America, Mexico, even in the US. So we want to bring that international. So we've been tirelessly working now for over the last 3 years to get finally this conference done. We had COVID in between, so we had to to hold a little bit. Yeah. But we did some webinars, and finally we set the date for December 8 to 10. And we had that first conference, and we're very excited to get started on that. So we're expecting a nice crowd from everywhere, from the Middle East, from Europe, from South America, from the people flying from the US, from Canada, from Australia. And we're bringing, the world leaders from not just the US, but from Europe, from Far East, from Australia. So we're very excited to get started on this meeting.
Yeah.
And the meeting will be mostly 3 days, from 8 to 10. The first 2 days will be mostly sessions, lectures, panels, data reveal. And the last day, which will be a cadaveric workshop and then those workshops will have training on different kind of minimally invasive procedures, neuromodulation, radio frequency, and procedures like that. So that's kind of how we're planning the conference.
Sounds great. I'm looking forward to it. Is there going to be, I know around the world, fluoroscopy is not as readily available as ultrasound. So is it going to be a little more ultrasound heavy, or are they going to do more fluoro, and with the hopes that the fluoroscopy will catch on and individual practitioners will get funding?
Yeah, so the focus will be mostly actually going to be a bit of both, but the focus will be fluoroscopy because there's a lot of neuromodulation, a lot of minimally invasive procedures and regenerative stuff, but also we'll have an ultrasound stations to practice some radio frequency, hopefully some PNS as well. So it's going to be a hybrid, but it's mostly going to be fluoroscopy focused. And yes, of course, there's some economic challenge for certain places to have fluoro, but I think everyone is catching up. And remember, David, that this conference is not just geared for pain physicians, especially in certain type of the world, it's pain physicians, but also neurosurgeons, spine surgeons from orthopedic background.
Sure,
they can all learn these things, and IR radiologists as well. Yeah. So that was the good thing about the society, that it's inclusive of all domains and how they can work together in peace, rather than have this competition, but rather work in harmony. And it's not always easy, but I think the society leadership, Aspen leadership, they're doing a great job being inclusive for all specialties. We've seen in panels people coming from anesthesia background, PM&R background, neurosurgery, orthopedics, IR. So that's what we hope our target audience would be.
I can absolutely vouch for that. I was basically absent in the early part of my career from all the meetings. I had young kids, was taking anesthesia call, limited vacation time. And then things, my kids got older, I stopped taking anesthesia call, things changed. And when I started approaching the organization saying, hey, I have this podcast, let me help market you, and maybe you help me by giving me some time at the meeting. Aspen was probably the best one, as well as NANS, in terms of welcoming and looking at the platform I have to help them and help me at the same time. There was some organizations, which I'm not going to mention, which are less welcoming, and I just don't really have anything to do with them. And those are organizations which, maybe are not doing as well now, because it wasn't just me, it's the younger generation. You want an organization that's going to embrace the new doctors and give them a voice. So I think Tim and Dawood and you all have it right. And I think it's going to be a great conference. I know Aspen was amazing, and every year it gets better and better.
Absolutely, David. You nailed that one. I mean, the society and Aspen Society, really, if you look at all the committees, all the presenters, there's a lot of younger folks coming. Yeah. And that's extremely smart and also good for the specialty, that you have the younger generations being able to voice, being able to be included early on, and then it kind of creates some sort of a loyalty to the society, and that's all the younger the fellows, they want to go to Aspen and they want to follow that model. And I remember, and I'm sure I'm going to mention, but we all seen some societies early on that they have the old man's kind of, you know,
Right, it's like a boys club.
Yeah, exactly.
Yeah,
Boys club.
right.
It's hard to get in. But that was one of the big things that Aspen was sure of, you know, following the inclusion of younger doctors, younger physicians to be included in the society.
Sure. So I assume that most of the conference is going to be in English. Is that a safe assumption or no?
Absolutely.
I don't mean to be an American, but typically,
absolutely,
most foreign doctors do speak English, so I figured that would be the.
Here we practice in English. All our practice, we have Epic system, we have everything in English.
Oh wow!
So yeah, it's all in English. We have Europeans; they have to speak English. But yeah, it's gonna be in English. Yes.
Great. So, if someone is thinking about submitting an abstract or just being a part of this or contributing, how could they reach out to ISPN? And
so I always get emails about that from Michelle. They can always do that. We haven't decided yet if we're gonna have abstract presentation or not during that meeting, because again, we don't expect it to, we're not expecting 3,000 people like the Aspen, but we're expecting a good number of attendees, and but we are open to that. So I've been getting a few requests. They can email me. They can email Michelle Byers, and we'll be getting names of people interested. We always want to include them in the, to participate as faculty or in the workshop. Again, the abstract presentation, we get a few interesting topics. So we'll discuss it with the leadership whether if we have at this meeting we can have a platform for abstracts.
Okay, that's great. And any idea where future meetings will be? I know it's jumping the gun a bit. Just curious.
Yeah, I mean, we haven't decided yet, but ideas like Mexico could be a target, Colombia could be a target, wow. Europe, could be a target. So we try to kind of, move it once in Dubai, the other, like we try to target different regions, and that's why kind of we evolved as a society.
That's great. So, I do board review for Pain Docs. So I have a lot of young doctors on my platform, people studying for the boards. You were a program director, and now you're, seasoned and very academic and involved with the societies. What advice would you give to a young pain physician who's just starting his career out?
Yes. So the first advice I would do is try to attend as much, as many meetings as possible, and try to get involved in the societies, because that build relationships, and relationships are extremely important. You can have mentors also. Always look up to somebody that you want to follow the path and try to learn. Try to talk to a lot of physicians with more experience and know yourself. You want to be an academic physician who focus on research, doing NIH grants, which totally, again, some people are really fascinated by this, and this is their passion. Or you want to do private practice and kind of be more of a practitioner and also incorporate research in it. Or some people want to do solo practice and practice. So you have to know where you stand and what you like. And you evolve as a physician, like what you want to do. Do you want to follow the academic route? You want to do a hybrid? You want to work as a health system? You want to follow a big private group and then be a partner? There is a lot of choices. And the only way to know is to, first, you have to speak to people and see your personality, what you like. The second thing also is, if you are into research is very important. It's well needed. If somebody likes research, it's going to be a lot of opportunities. Our field is still, although there is research, but there's a lot of opportunities to do more research. And it can open a lot of, you can get grants, you can do industry-sponsored research, and build a lot of connections as well. And also it boosts also your reputation as a physician when you talk. So that's kind of my advice in short. And again, I'm not shy of doing risks and doing adventures, as you can see. But I always follow, when you say follow your heart, so I always like to follow my heart. That's why I did this. And there is no right and no wrong. And each step you take, there's benefits and there's pros and there's cons.
Sure. Yeah, I think everybody has a very different journey when it comes to sorting out what they want. And you know, a lot of people are financially motivated, and that's fine if that's, but it's not everything. And just,
At all.
yeah, and waking up in the morning and just being happy to go to work is probably, you know, it's priceless. But of course, you know, some people want more control, some people want more of this, more of that. So there's different things for everyone. So I wanted to ask you before I let you go. So we touched on this briefly earlier, but practicing in terms of, I mean, you mentioned a little bit about it, but how does it work with the payer system? Like the difference in practicing out there versus in the US, like culturally, as well as the whole system of insurance, et cetera.
Yeah, it's a little bit more, so it's insurance based system. And of course you have cash paying. Sometimes I get international patients, and we have a division for that, and then we can do that. But for the most part, it's insurance based, and there's tiers like the US. Again, there are tiers that, you know, that are pretty straightforward, and there's lesser tiers that you may require, you know, prior authorization or require, you know, further justification. There are certain insurances from expats is different from the people who are from the country. It all has different type of insurance. But again, so some insurance, they actually cover for everything, like anywhere in the world. Some insurances cover for some of the stuff, other stuff not really. And it really depends on the tier and your job and what type of insurance you get. Certain insurance, for example, they tell you, well, we'll reimburse you, but you pay first for certain things. Others, they have like some sort of a deductibles, and then when you set deductibles, they can reimburse you. Other, you can have co-pays. So it's really very, not exactly like the US per se, but it's fairly similar in a lot of facets. Mm-hmm. But what's unique here, again, it's different. We are very mix of different people from different countries. As you know, the UAE's 90% are expats from different countries. Sure. So in Cleveland Clinic Abu Dhabi, we see a lot of local people from Emirates, but we also see people from different countries coming as well. So, for example, what's relevant to our field is we have, you know, certain more expensive devices like spinal cord stimulation that are not necessarily approved anywhere, but they want to approve it in a reputable place like Cleveland Clinic, when they know that physicians are top notch. They're not going to overutilize, you know, insurance, and they will have good outcome. Mm-hmm. As we know, it's a double-edged sword. If everything is approved and you start overutilizing the system, it always backfires.
Oh yeah,
like the. So in short, I mean, it's similar, not identical, but it's kind of similar to the US.
Got it. Sounds interesting. I'm looking forward to coming. Is there any other way you would recommend that Aspen spreads the message internationally to let other docs know about what they're doing and what they're about?
No, I think this podcast, for example, I know, David, you've been doing a great job, generally speaking, about, you know, and I remember PainExams, right? Yeah, and a lot of fellows, including myself, who used to do that for our board. But I think you use your platform to do that. We have a, you know, word of mouth spread. We have marketing. So all people are excited about Aspen, and I think that people would be extremely excited to see Aspen grow internationally. Sure. So, for example, in the Middle East here, Aspen, they're still not that familiar with Aspen. They hear about it, but it still takes time. So, as a local organizing company, they have to know, you know, we have this. This is our mission. This is what we're doing. This is why the society is different than other societies. And by using, you know, marketing, word of mouth. There's a lot of physicians that I know here. They know me personally, so they get interested. They look at the agenda. They have a strong agenda. The faculty, and they get excited. So I mean, platforms, marketing campaigns, word of mouth. Having platforms like a podcast with David Rosenblum and other venues, so they can know about it, and having a strong program and a strong faculty that can drive people coming. I have a strong lineup from the Aspen leaders and strong lineup from local physicians here and from Europe. We always know that those people are coming. Tim Deer, Daoud, Jason Pope are coming. The leaders from Europe, the leaders from the Middle East, from the Far East, trying to get the best of of every that fits the Aspen agenda, and we hope that this is going to be really a great success.
That's great. Well, I think everybody who's listening to this is probably going to want to check out the website and find out more, because this is probably going to be an amazing conference, and I'm hoping to be there. So they go to aspenpain.org, or is it ISPN?
No, they go to Aspen and find ISPN, and over there's a link for registration.
Okay.
And then through this link, they can register for the meeting, and also they can look for the hotel room as well.
Okay.
We have it in the Intercontinental in Dubai. So I encourage them to start the sooner the better, because those rooms, especially in December, they they fill up pretty quickly.
Definitely.
Yeah.
Well, it's Friday morning in New York and probably Friday evening in Abu Dhabi. So I'm going to let you get back to your, I assume, family, as opposed to hopefully not work. Hopefully you're done for the day. And I wanted to thank you for coming on the podcast. If you have anything closing to say to everybody, feel free.
Thank you. First of all, thank you so much, David. Thank you for your efforts in your podcast. You've been doing really well. And again, I'm looking forward to this ISPN meeting in December, and I'd like to welcome you. I welcome all physicians all over the globe to come and attend this meeting, and we're looking forward to welcome everybody. It's going to be great.
Thank you. Thanks for being on the show, and thanks for your time. And guys, just be sure to check out the website. You'll see this podcast episode and video, as well as a link to ISPN's conference coming up. Thank you, and take care. Take care.
Thank you, David.